Good evening, everybody, or good morning, or good afternoon. This is your podiatrist, Dr. Alvin Cowens. I just want to talk to you real quick about ingrown nails. The medical term is called onychocryptosis. It is when the nail borders, the sides of the nails, are actually growing downwards and into the skin folds along the sides of the nail. The nail can continue to go deeper into the nail, causing the skin to build up and to become swollen, red, painful, even cause drainage and this hypergranular, like reddish-looking tissue to be surrounding the nail. So the medical term is called onychocryptosis, but ingrown nail. There's three different phases of ingrown nails. You have mild, moderate, and severe. What I've been reading, Mazina and Martinez Nova, they actually broke it down to like three categories. One is just inflammation. 2A is they're saying abscess of the nail fold, less than 3 millimeters of it. 2B is abscess of the nail fold, greater than 3 millimeters of it. The third phase is granulation and chronic nail fold hypertrophy, basically saying there's excessive skin, reddish skin around the nail fold areas, around the corners of the nail areas, with excessive skin formation, thick skin in that area due to the nail being embedded into the nail fold. And stage 4 is axial deformity of both nail folds and distal nail folds, where the skin is just pretty much overlapping the nail and it's thick, swollen, and like larger than a pea size, and it's red and beefy looking. So, as we all know, ingrown nails are very, 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 very painful. I know a lot of people like to, when they're at home, they like to dig them out themselves, which a lot of times can lead to other issues like infection, excessive bleeding, more pain, actually causing even worse of an ingrown nail because you don't get all the ingrown nail out when you do it because it's too painful. So the key is your own bathtub surgery. Getting those ingrown nails aren't the best way. But anyways, I'm going to talk about causes of ingrown nails. There's certain things that can cause your nail to just grow inwards and be very painful. One is cutting your nails rounded. It's okay for your fingernails, but when it comes to your toenails, you do not want to round off your nails. It encourages your nails to grow into your skin when you round it off. So what you want to do is make sure your nails grow out long enough and you just cut them straight across. You cut them straight across. Next is irregularly curved toenails. A lot of people have what we call pincer nails, where the nail just naturally grows in like a U type fashion. Where a lot of that is genetic. You get a lot of times, a lot of people get those curving nails that just naturally curve like that into the skin. Where people wear proper shoes, proper socks, and take care of yourself well, and just naturally just curve in. A lot of that is genetics. Next is narrow footwear, socks and stockings. The pressure from the sides of these shoes and your socks can actually press the nail in a downward fashion into your nail bed area. So tight shoe wear, tight socks, and tight stockings. Beware of those because those contribute to it. Improper hygiene. You're not cleaning your feet on a daily basis. You're not washing your feet on a daily basis. You're not changing your socks on a regular basis. You're not washing your socks on a regular basis. You're not taking proper care of your feet, including the nails, can lead to ingrown nails. Athletic sports that promote excessive kicking and excessive striking of either a ball or an object or even another person. Sports such as ballet, when you get on point, puts a lot of pressure on the nails. Football, especially if you're a field goal kicker, you're a punter. Athletes stepping on your feet, that can contribute to ingrown nails. Soccer, as we all know, kickboxing, martial arts. These are a few sports that can promote ingrown nails due to the excessive striking of the feet, the forefoot, and the toenail area. So beware of that. Flat feet contribute to this. When you have flat feet, you do what we call pronate, where your feet kind of collapse inwards and you put a lot of pressure to the medial side, the toenails of your both feet. That can contribute to it. Poor posture can contribute to ingrown toenails. And lastly, genetics. I believe plays one of the largest factors in ingrown nails these days. But genetics can contribute to ingrown nails. So what are the symptoms? This will let you know that you're having ingrown nail problems that need to be taken care of, that you need to go see your local podiatrist or so they can have those ingrown nails removed and try to prevent these reoccurrence of ingrown nails. So one, if you see redness and swollen, thick, like pea-sized tissue around the nail bed area, around the corners of your nail bed area, out of nowhere, that might be an ingrown nail. Pain in the region. Sometimes you may not have the redness or swelling, but if you have pain in those in the nail border areas, the medial or the lateral nail border areas, then that could be caused by ingrown nails. Largely, majority of ingrown nails are the big toe of both feet. Those are where you get ingrown nails. Now, you can get it on the digits 2, 3, 4, and 5, all the other remaining digits, but they're less likely as opposed to the great big toenail, the big toe. Another, bleeding. Let's say you have bleeding and drainage coming from that area. That might be a sign that you're having an ingrown nail with the nails curving in and causing damage to the inner skin layers of your great toe. Pus drainage. If you see pus draining out of it, not only you have an ingrown nail, but that ingrown nail may also be infected. When you see pus drainage, you're dealing with white blood cells and you're dealing with bacteria, you're dealing with other issues where your body's trying to get rid of this, trying to fight off an infection. So pus drainage in those nail border areas, that's another symptom. And also, lastly, I say overgrowth of tissue. When you see this red, beefy tissue in a circular ball kind of sticking up in those nail border areas, we call that like a granuloma from the medical terms, or hypergranular tissue, or excessive red, thick, beefy tissue. That's another sign that you have an ingrown nail in that area that needs to be taken care of. So there's many routes to take care of the ingrown nail. If your doctor just removes the ingrown nail, I was reading a study in JATMA that it still has about a 70% reoccurrence rate if you just remove the ingrown nail. But that is an option, especially when you have a bad infection in the area. You kind of want to remove the nail and start you on some antibiotics. But if it's just an irritated ingrown nail, then you might want to look to other avenues, such as more of a permanent procedures like matrixectomies, where you apply certain chemicals after you remove the nail into the nail bed, such as phenol, sodium hydroxide. These are chemical compounds that help to destroy the cells in the nail bed area that cause the nail to kind of grow inwards. So you destroy that inward growth of the nail due to destroying the cells that produce the nails in that area. You have surgical matrixectomies, where you remove a portion of the nail bed that produced that ingrown nail. That's another method. You have other surgical procedures include like nail fold excision, where you don't take out the nail itself, you don't damage the germinal matrix or so. You just remove the soft tissue from around where the ingrown nail is to relieve the pain. So that's another way of treating the ingrown nail. And then you have other surgical procedures where you remove part of the nail. You can remove part of the nail bed. You do soft tissue procedures in order to fix the ingrown issues. If you're having these chronic ingrown nails, procedures like the Frost procedure, Zadek procedure, Kaplan procedure, Winograd procedure, Suppin procedure. These are all many different procedures that can help to permanently prevent any future ingrown nails by removing soft tissue, skin, you're removing nail bed, matrix, you're removing some portions of some bone. You're just doing a lot of invasive surgical procedure in order to prevent any further ingrown nails in the future. So chronic ingrown nails. And then lastly, there was another article I read in the JATMA Journal of American Podiatric Medical Association. It's a matrix plasty where you put a little device on the nail, and what it does is it straightens the nail from being curved up to more of a flat, normal type of a nail. Taking it out of taking it out of the nail bed and out of the nail borders and digging into the skin, it kind of straightens out the nail, freeing it from that incurved position and causing pain. Reading the study, it showed that they had about 0 to 20% reoccurrence rate. It's another procedure that doesn't require surgery. Now applying this, it doesn't happen immediately. This is a process that happens over time with applying that device to the nails over a longer basis in order for it to heal. So the key is when you got an ingrown nail, you want to pay attention to it. Let's say you have a mild ingrown nail, very mild. It's just you're starting to feel a little irritation in the area. It's not too much, but you're not seeing signs of redness, swelling, drainage, pus drainage, bleeding, signs of infection. You just see just a little irritation in that area. A lot of that can be treated with conservative treatments such as soaking, Epsom salt, things that kind of soften up the nail and nail bed area. Little cotton wisp, or like a little bit of cotton underneath the nail, which kind of brings the nail from being curved to more of a flat, straight position. Those are little small things that can help. With that, even a little bit of antibiotic ointment to the area wouldn't hurt. So those are little small conservative for mild ingrown nails, but for more moderate to severe ingrown nails, require a normal like small surgical operation and intervention with possible chemical application to go along with it to prevent any reoccurrence. So, anyways. Anybody can get ingrown nails, from little infants all the way to the elderly. So these things, make sure you take care of your feet. Like I said, again, make sure you cut your toenails straight across properly. Do not wear any narrow footwear, socks, and stockings. Make sure you have proper hygiene to your feet. If you have any athletic sports that require kicking or so, make sure that you're checking your feet on a regular basis. Try to make sure, if you can, wear some more padded type socks, or more comfortable, not tight socks, like a dry fit sock or something like that. If you have flat feet, over-the-counter orthotics will help with decreasing a lot of that pronation or pressure to the toenail areas of both feet. Make sure that you have good posture and just be hyper vigilant of your feet. I mean, that's your livelihood. It keeps you moving, keeps you walking. Don't want to have any pain. You don't want to have any infections. Anyways, this is your podiatrist, Dr. Alvin Cowens, just giving you a little brief synopsis on ingrown nails. You can follow me on YouTube at Alvin Cowens, podiatrist, and also on Facebook as Alvin Jeffrey Cowens when I go Facebook Live. So anyways, thanks you guys for listening. If you have any questions, you can email me at jeffcfau25@hotmail.com. You can hit me up on Facebook, and subscribe and share this with other people so they know a little bit about ingrown nails. It's a little brief overview synopsis, and didn't go into big details, but hopefully this is something that you guys can learn and take with you as you go about your day and go about your week and year. All right? Anyways, take care, guys. Take care of each other, and I'll see you soon. Bye.